Hi, good morning and welcome to WGTV Today. I'm Kim Best, your host. Thank you for watching, and I hope you'll learn a little more about what's happening in your community. Today I have with me Cindy Stallard. She is the occupational health nurse with the city of Goldsboro. Welcome, Cindy.
Thank you, Kim.
I guess I say welcome today. Cindy is here today. She's going to be talking about the wellness opportunities for the month of October, which is flu shots. She's going to be talking about flu vaccines, and guess what? She's going to give me one today. So that's why I say I guess I welcome her here today. But Cindy is going to tell us first some information about why we need flu vaccines and what it prevents and what are some of the side effects.
All right, so protecting yourself against the flu is very important because it could take you out of work for up to 2 weeks, and so we want to avoid that. If somebody is sick with the flu, please don't bring it to work because you don't need to share it with your coworkers, of course. But we do want to give you the vaccine if you're able to take it, and it's important to get the vaccine. It is not a live virus. It is dead, and it will give your body the opportunity to build up immunities against it, so that's very important.
How long does the flu vaccine last? Is there a certain length of time?
6 to 8 months.
Okay.
And our flu season actually will go into the springtime, into the March, April, May.
Well, each year I hear people talk, when they're talking about getting their flu shots, I hear them say, well, every year the flu virus is a little different. So are they adjusting the flu vaccine to meet those needs?
They do. Every year the scientists sit down and look at the different strains that are out there, and they pick what they think is the best formula, and that's what goes out.
All right,
so
so
this
you
year
encourage everyone to get their flu vaccine.
We do, and we have the H1N1 in it, and a H3 and a B strain. So you see there's 3 different strains that are in there, and they're hoping that, you know, it works out well. So anybody with small children should get a vaccine. Kids school age, important college age kids, they're in school as well because you're exposed to so many people, so it's very helpful.
And how about older citizens?
Definitely. Anybody up to the age of 65, anybody with asthma, diabetes, any of those comorbidities, it's good to protect yourself from that because we have a lot of elderly that actually die from getting the flu. So we want to avoid that.
Well, okay, so once we get the flu shot, what type of symptoms should we be prepared to see, side effects?
You may have soreness at the site of the injection. You may have a little bit of swelling there. You may have runny nose, sometimes a little bit of a headache. That's about it. It is not live.
So I'm going to feel really good in a few minutes.
Yeah, you do want to protect yourself, especially working with the community.
Right, right.
So.
All right, so we're going to go ahead and give me a flu shot.
All right.
Cindy's going to show us how it's done, and then we're going to move forward and have some other topics we're going to cover.
Right, and Kim has already signed her her consent, answered some questions, and she signed her consent, so we're going to press on.
All right, Cindy, be gentle.
All right, I'd like you to just extend your arm. Very good. This is a cold alcohol. Okay. You feel my fingers? 1, 2, 3. You may feel the medicine go in.
Yeah, I feel it going in, but it's just something different. It's not hurting.
All finished.
All finished. Good job, Cindy. Didn't hurt much
for you.
Yeah, you did good.
All right.
Perfect. Very good. All right, so I'm covered. I've had my flu shot.
Very good.
All right, thank you very much.
You're welcome.
So now let's talk about breast cancer. I know this month we want to make sure that everybody is aware this is Breast Cancer Awareness Month.
It is.
And some of the things that we need to be prepared to do.
As a woman, everybody should be comfortable with themselves in order to do a self-breast exam. That's very important because sometimes we can find things that the doctor doesn't find. You know, maybe a lump that's tender, and it's just important. When we get to the age of 40, we're allowed to have mammograms, and it's like every other year or every 2 years that you can have a mammogram, and those are very detailed now. They're much better than they used to be. And
is it the same format still that has always been done? They haven't changed that up much?
No, for a while they were talking about the age going to 50 when you start getting mammogram, but it's still good to start at 40. If you have a family history, it's even better to start earlier, and your doctor can be a good person to advise you regarding that. So I did check with both Wayne Memorial Hospital, their mammography lab, and Wayne Radiology. They are both very handicap accessible. So people that have handicaps that are not able to get out of a wheelchair or bedbound, they can still have their exams, which is very good to know.
And that's good to know that we have that. We provide that service locally.
Right. Right, and I just spoke to both of them today to find that out.
Okay. So Cindy, tell us about Breast Cancer Awareness Month. I know October is the month we really want to draw attention to breast cancer and preparing ourselves and checking ourselves. So can you give us some details of things we can do as women?
Right. We talked about self-breast exam being very important. You have to be very comfortable with your body, and I think on the website there's actually like a chart of how to examine your breast. And then next to skin cancer, breast cancer is the second highest killer of women. So that's kind of scary. And you know, we think about family history. There are a lot of first-time breast cancers out there that don't have a family history. They are beginning their family history with that. And so it's hard to understand why it happens sometimes. It can be very devastating to somebody.
Are there certain ages where you should start getting breast exams?
If they're sexually active or getting into, you know, their 40s, actually we should be doing our breast exam from the time they're sexually active and on through our life. So as we get older, our chances increase increasingly. Really? Yes, like in 30 age, it's like 1 in 233. By the time you get to 60, it narrows to like 1 out of 29.
Oh my goodness.
So
that dramatically drops.
It does. Because of our exposure to estrogen throughout our life, it makes a difference.
My goodness. Well, how about for men?
Men can have breast cancer also. If they had anything unusual, they should check with their doctor right away, as you know, lumps in their breast. When I worked in the operating room, I had seen a couple men that had breast cancer and went through mastectomies, so it can be devastating to them as well.
I'm sure. So men need to check themselves as well.
They do.
And how about the month of October, like we said, is Breast Cancer Awareness Month. Are there things going on in the community to make people more aware that you've heard of?
I've not seen anything in Wayne County. I've seen some different promotions from around the United States where they're doing something called Pink Love.
Yes.
Have you heard of that? And if you just Google Pink Love on the internet, you'll see all kinds of dances with Pink Love, and they're just having a good time promoting, you know, the
entertaining ways to promote the month.
Right, exactly. It's a lot of fun to watch those. So.
Well, for the months coming up, it's going to be, you know, our fall months are typically when people start to get sick and have different illnesses. Can you tell us things that we can do to prevent some of these illnesses, everyday things that we can do?
Sure. Good hand washing is one of the most important and easy things that we can do. So if you don't have soap and water around, these little containers of the alcohol gels are very important, yes. And if you notice on them, they shouldn't be at least 60% alcohol in these to be effective.
60% alcohol.
Right.
And it says that on the bottle.
Yes, this one is 62%.
Okay.
So, and that's very important. But soap and water.
Right here so everybody can see it.
Okay, soap and water is actually the best if you have it. If you don't, the waterless gel.
Is there a certain length of time you need to wash your hands?
It's a good question. We should sing happy birthday twice quickly to ourselves while you're washing your hands so that you make sure you're doing it long enough.
So that's the length of time you need to continue with the soap and water to get rid of all the bacteria.
That's right.
So happy birthday. We have to sing that twice really fast.
Right.
All right. So that's washing our hands.
And one other thing we can do is make sure that we cover our cough. And it's cool now to you know, cough into your sleeve, and the germs will die on your sleeve instead of like coughing into your hands, opening a doorway,
or shaking a hand,
or picking up a phone that somebody else will use later on.
Right.
All those things. So
and
cover
I
your
would think
cough.
Turn away from people as you are covering your cough.
All those things are excellent.
Great. Okay. So one of the things we talked about earlier was using hand sanitizer, washing your hands, turning away from people whenever you're coughing or sneezing or whatever the situation may be. Is there anything else we need to be prepared for through the months of fall and winter?
Well, if you are sick, don't bring it to work. Your coworkers will definitely appreciate that.
Stay at home, get well, then return to work.
Right.
All right. Well, Cindy, thank you so much. We want to tell her thank you, but we also want to remind you all of these tips that she's given you. Take them into heed. Do these things. Keep yourself well through the month of October and all the way through the fall and winter months. If you have questions about breast cancer, what was it you said we could Google to find out about breast cancer love?
Yeah, Pink Loves.
Pink Loves. Okay.
Yeah.
And is there a certain website with that?
No, it'll come up.
Okay, just Google it. It'll come up. You can find out tons of information and start getting your mammogram today if you are of the age of 30-ish.
Yes, that'd be fine. Well, actually 40. But
it's 40 now? Okay.
Right, it's 40 now.
All right, start at age 40, get your mammograms being checked. If you're a man, check yourself as well. We appreciate you being with us today. This is WGTV Today, and this is more about what's happening in your community.